This week's Ask Dr. Durie is a question that has been answered before, but I think it does bear re-emphasizing. And the question is, for patients with myeloma who have significant bone lesions, do the bone lesions regenerate back to normal? Well, the simple answer is no, unfortunately. But it's important just to discuss the details a little bit. And so basically, when myeloma is destroying bone, you have a lesion which is growing into the bone. When you give the treatment for the myeloma, you wipe out the myeloma, but then you still have the hole in the bone which is left. And so there is this significantly weakened area in the bone, which is basically a hole. It does fill in with scar tissue and with calcium, but it doesn't remodel the architecture of a bone. One of the clever features of bone is that it has very interesting and important scaffolding within the bone itself, which gives it tremendous strength, and that just does not redevelop. But it does fill in with scar tissue and with calcium, so it does have some strength, which is good, but not really good enough for major activities in some cases. And so why is that? Well, the big thing about myeloma is that you can stop new bone destruction. When you treat the myeloma, you stop new bone destruction. When you give Iridia or Zometa, the bisphosphonate therapies, those drugs also block the osteoclasts, and so there again you block new bone destruction. But as of now, we haven't got an effective way to trigger new bone healing, which requires the osteoblasts. Now, we have learned that Velcade, the proteasome inhibitors, they do stimulate osteoblasts to some extent, and also IMiDs, such as Revlimid, do have some properties linked to bone healing. Unfortunately, from the various studies that we haven't documented really well just how much bone healing does occur with those novel agents. But there's certainly some bone healing with these novel agents that we did not see in the past. But the bottom line is, no matter what, unfortunately, if you've had significant myeloma bone disease, those bones are going to remain weak. And if they are in critical areas, what we call weight-bearing areas, and those would be the lower back area, the pelvis, and especially around the hip areas where most of the weight of the body is carried when you're up and walking around, those do need to be checked very carefully. And I actually recommend a careful review by an orthopedic surgeon if you've had damage in those areas, just to make sure that you are secure for weight-bearing activities, and especially if you want to be carrying out any other additional activities like tennis or golf or go horse riding or any kind of more major activities, you certainly need to make sure that those areas are strong enough. And sometimes I've recommended in the hip region that a patient might have a pin placed in the femur, which is the major hip bone, to strengthen it so that they can return to full activities. The goal is to strengthen or help patients to build up muscles so that they can return as much as possible to normal, full activities. But unfortunately, this does include the fact that some of the bones are weak, and some cautions may be necessary moving forward always, just to be aware that a leg or an arm may not be up to full strength. So unfortunately, bones don't heal back to normal, but usually things can be modified and you can work around it to have some pretty good recovery of function.